We are a day out from having the fat transfer and the plasma, and this is just a post-op visit. How's everything?
Everything is good. Everything feels fine.
Good.
Swelling has gone down a little bit from yesterday. Some tingling, but as far as pain, the pain is very little, if any, today.
Good. So we're going to follow you at home and make sure everything goes well for you.
Okay. Okay, this is Diane, and this is my second day. It's the end of the second day. As you can tell, I still have a lot of swelling. As far as pain, on a scale of 1 to 10, pain is like 2. I've really been very comfortable unless you push on certain areas, and then they're tender. I did have the plasma as well as the fat. I'm going to say grafting, that's the wrong word.
No.
Okay, I did have the double process with the fat transfer and the plasma, which probably creates a little more swelling than normal. The swelling comes and goes. I have certain places that swell more than others, and I have started the icing procedure today, and also am still using the balm as far as for moisture, and have now started the washing process, and we'll stop the balm tomorrow and go with the moisturizer. Therefore, when you have the balm on, it makes it very, very sticky, tends to appear even, all the bruising tends to appear to show up even more so. According to Dr. Lamb, everything is going the way it's supposed to be going, so we'll just take it a day at a time and see what tomorrow morning starts out. This is day 4 of the fat transfer and the plasma. Still very swollen. A lot of the skin is beginning to now slough off, and new skin is beginning to form underneath. It is very tight, itchy in places. The swelling comes and goes, and the bruising is still a little bit tender. Another day going forward, and we'll see how it'll be tomorrow. This is day 4. It's the afternoon of the 4th day. I have been in to see Dr. Lamb. He tells me everything is progressing as it should, though I tell him I still feel like I'm wearing my Halloween mask at this time. Still not socially acceptable to go outside, but I can see the changes with the skin, where the white is the new skin that's healed, the pink that you see so heavily is new skin coming through, and of course the dark brown is the old skin that's sloughing off. Still have more swelling than what I would like right now, but evidently it's on track doing what it's supposed to be doing, and we'll take it another day at a time. It's a little less swollen today than it was yesterday, and hopefully tomorrow will be reduced some more as well. Hi, this is Diane. This is day 7. I go in for my checkup in a few minutes, and I don't have anything on my face at all right now, even the moisturizers. I just took a shower. But this will give you more of an idea without seeing all the shiny that the moisturizer produces. It feels very good. I am still very, very swollen. I personally do not feel like I look anything like myself right now. My lip area the cheeks are very swollen here, which is making my lips pulled and almost kind of taken over by my cheeks. Eyes have been an area through here that have been very swollen. The brows, the underneath, it's very tight and hard, and quite a bit of bruising still. The swelling goes back and forth between my left and right eye. It had been that my left eye was more swollen. Now it's my right eye that stays small. So I keep ice quite a bit on the face to kind of work it and bring it down. Most of the skin has come off. What's underneath looks very good. Still have some places underneath, right around the hairline, that haven't flaked off yet. I would say by tomorrow it should all be gone. But we'll see what he says today. I have watched the other videos as I was beginning to get somewhat depressed by this massive swelling, and I'm a person that just can't sit down and stay still, and I need to get out, and I can't get out yet, but I think I can see some improvement now. Still working on a few lumpy areas that I feel under my chin. I'll ask Dr. Lamb about that today. As far as pain, the only discomfort I have had is where it's been very tight under the eyes, and it feels like if you could just pop it with a pin, you could relieve the pressure. It's very bruised, and therefore, like any bruised area that would have swelling, if you touch it, press on it very hard, it's going to be very tender. I haven't taken pain pills just because I do have a pretty good pain threshold, and I don't want to take them. I took them as much of anything to see if I could sleep. I've had more problems sleeping than anything else, and it's just because my time of the way I work and things that I do is totally off schedule. But we will see how, what he says for the next step, and I'll either be back with you to show you a little bit more of where we are or where we end up, but we're traveling along, so it's another day.